forearm. The forearm is that part of the upper limb that extends between the elbow joint and the wrist joint. The bony framework of the forearm is formed by two bones, the radius, which is the lateral bone of the forearm, and the ulna, which is the medial bone of the forearm. The radius, which is laterally placed bone of the forearm, has small upper end and large lower end. The upper end articulates with the humerus at the elbow joint, whereas the lower end of the radius articulates with the carpal bones of the hand to form the wrist joint. The second is ulna. The ulna, which is the medial long bone of the forearm, has large upper end and small lower end. The large upper end articulates with the humerus at the elbow joint, but the small lower end do not articulate with the bones of the hand at wrist joint. So the ulna takes part in the formation of elbow joint and in the formation of superior and inferior radio-ulnar joints. It does not take part in the formation of wrist joint. So it is the medial bone of forearm, articulates with the humerus to form elbow joint, radius to form radio-ulnar joint. The ulna does not participate in the formation of wrist joint. Now the radius transmits the weight to ulna via the interosseous membrane, which is attached to the interosseous border. Like the other long bones, the ulna has an upper end or proximal end, shaft, and the lower end or distal end. So first we will discuss the upper end. As we have discussed earlier that the upper end of ulna is large as compared to the lower end. On the upper end of ulna, there is the presence of certain important features. So these important features are Olecranon process. This hole is the Olecranon process. The second is Trochlear Notch. This grey colored is Trochlear Notch. The third is Coronoid process. This one is Coronoid process. Radial Notch, which is present below the Trochlear Notch. Then the Supinator crest, which is present below the Radial Notch. So on the upper end, Olecranon process is present, then Trochlear Notch is present, Coronoid process, Radial Notch and Supinator crest. These are the important features of the upper end. So first we will discuss the Olecranon process. The Olecranon process is basically the upward projection of the upper end. Look at the picture. This is the Olecranon process, which is the upward projection of the upper end. Now this Olecranon process has certain surfaces. So the first is anterior and lateral surface. The anterior and lateral surface of the Olecranon process is articular. It forms the Trochlear Notch. So the anterolateral surface of the Olecranon process, which is articular, takes part in the formation of the Trochlear Notch, which is the second important feature of the upper end. Then there is the presence of superior surface of the Olecranon process. Now on the superior surface of the Olecranon process, there is the presence of rough impression for the attachment of muscles. This is the superior surface. So the first is anterior lateral surface, which forms the Trochlear Notch. This yellow colored is the Trochlear Notch, which is formed by the anterolateral surface of the Olecranon process. Then this small is the superior surface with rough impression for the attachment of muscles. Then this hole is the posterior surface of the Olecranon process. Now the posterior surface of the Olecranon process is smooth and triangular, and this posterior surface is palpable as the tip of the elbow. So the palpable tip of the elbow is basically the posterior surface of the olecranon process. The second important feature is the presence of coronoid process. Now the coronoid process is the forward projection of the upper end. We have discussed that olecranon process is the upward projection of the upper end. Just below the olecranon process, there is the presence of coronoid process. This brown colored is the coronoid process, which is the forward projection of the upper end. Now look at the lateral aspect. This whole is the coronoid process, which is the forward projection of the upper end. Now this coronoid process again have surfaces. The first surface is the superior and the lateral surface. Now the superior and lateral surface of the coronoid process also take part in the formation of trochlear notch along with the olecranon process. So the superior-lateral surface, look at the picture, this whole is the coronoid process. This whole is the coronoid process. Its superior surface and small part of lateral surface. This whole is the superior surface of the coronoid process, and small part of the lateral surface take part in the formation of trochlear notch. The second is lateral surface of the coronoid process. On the lateral surface of the coronoid process, there is the presence of radial notch. This is the radial notch. Below the radial notch, there is the presence of supinator crest. Okay, so the first is olecranon process, which we have discussed. Its anterolateral surface forms trochlear notch. Superior surface bears rough impression for the attachment of muscle. Posterior surface is smooth and palpable as the tip of the elbow. So this all is about the olecranon process. Then the coronoid process, this brown color, its superolateral surface forms the trochlear notch. Its lateral surface forms the radial notch. Below the radial notch, there is the presence of supinator crest. In addition to these, there is the presence of rough impressions on the anterior surface. Now look at this picture. This hole is the coronoid process. Its superolateral surface forms the trochlear notch. Lateral surface forms the radial notch, which articulate with the head of radius. Below the radial notch, there is the presence of supinator crest. And then the most important feature on the coronoid process is the presence of ulnar tuberosity. Now on the anterior surface, this is the anterior surface of the coronoid process. On the anterior surface of the coronoid process, there is the presence of rough impression for the attachment of muscles. On the distal aspect or on the apical side of the anterior surface, there is the presence of large tuberosity, which is called as ulnar tuberosity. Clear? So the first is olecranon process, upward projection of the upper end. Second is coronoid process, forward projection of the upper end. Then there is trochlear notch, which is formed by the anterolateral surface of the olecranon process and superolateral surface of the coronoid process. Then there is the radial notch, which is present on the lateral surface of the coronoid process. Below the radial notch, there is the presence of supinator crest. Then ulnar tuberosity, which is present on the anterior surface. Now come to the shaft of the ulna. Like other long bones, the shaft has 3 borders and 3 surfaces. Anterior border, introitious border, and the third is posterior border. Now the anterior border is smooth and rounded. Look at the picture. The anterior border is smooth and rounded. It extends from the coronoid process up to the head of ulna. Then there is posterior border. The posterior border is sharp and it is palpable throughout its length. This posterior border extends from the posterior surface of this coronoid process up to the head of the ulna. The third is introitious border, which extends from the radial notch up to the styloid process. So there are three borders. The anterior border, look at the picture, extends from the anterior surface of the coronoid process up to the head. Posterior border extends from posterior surface of Olecranon up to the head of the ulna. The third is introitious border, which extends from the radial notch up to the styloid process. Then there are three surfaces. The first is anterior surface, which is smooth. On the upper and middle 1/3 of the anterior surface, there is the presence of nutrient foramen. The second is medial surface. The medial surface again is smooth and unremarkable. The third is posterior surface, which is important because the posterior surface is divided into different parts by an oblique ridge and then by longitudinal ridge. So first, this is the posterior surface. This is the oblique ridge which divides the posterior surface into upper part and the lower part. Then the lower part is further divided by a longitudinal or vertical ridge into the medial part and the lateral part. So three surfaces: anterior surface, smooth, and on the anterior surface you have to remember that there is the presence of nutrient foramen at the junction of upper and middle 1/3. Medial surface, smooth and unremarkable. Posterior surface is important because on the posterior surface multiple muscles are attached. So posterior surface is first divided into upper and lower part by the oblique line, and then the lower part is further divided by a vertical line into medial and lateral parts. Now come to the lower end. On the lower end, as we have discussed, that the lower end is small as compared to the upper end. On the lower end, two important structures are present. The first is head of ulna. The first is head of ulna. This hole is the head of ulna. The head of ulna is mainly covered by articular disc. The second is styloid process, which is the downward projection of the lower end. Now posteriorly, on the lower end, posteriorly there is a groove for the tendon of extensor carpi ulnaris. This is the tendon of extensor carpi ulnaris. This tendon runs in a groove which is present on the posterior surface of the lower end. So this all is about the parts of the bone: upper end, shaft and lower end. Now come to the side determination. So in the side determination you have to remember certain points. The first is trochlear notch is placed anteriorly. What is trochlear notch? A notch which is formed by anterolateral surface of Olecranon process and superolateral surface of coronoid process. So you have to hold the bone in such a way that the trochlear notch is placed anteriorly and superiorly. This is the trochlear notch, is placed anteriorly and superiorly. So this is the first point which you have to remember while holding the bone in the normal anatomical position. So the first point, you have to hold the bone in such a way that the upper end is large and lower end is small. First point. Second is, look at the picture, upper end is large, lower end is small. This is the first point, to hold the bone in normal anatomical position. The second is trochlear notch, which is placed anteriorly and superiorly. Third point, the ulnar tuberosity which is present again anteriorly. This is the ulnar tuberosity which is also present anteriorly. The fourth point is radial notch. This is the radial notch which is placed laterally. So for the site determination you have to remember 4 points. The first is large upper end, small lower end. Second is trochlear notch which is present anteriorly and superiorly. Third is ulnar tuberosity which is present anteriorly, and the fourth is radial notch which is placed laterally. Now the ossification. For the ossification there is one primary center for shaft in most of the upper end which appears during the 8th week of gestation. Two secondary centers for both the ends which appears later in life. Now come to the attachments of ulna. Now these are the muscles which usually insert on the ulna. So the muscles which are written with blue color inserts on the ulna. So the first is triceps brachii. The triceps brachii is inserted on the posterior part of the Olecranon process. So this is the Olecranon process, and this is the posterior surface of the Olecranon process, which is large, triangular, smooth. So on the posterior surface of the Olecranon process you have to remember the two muscles insert on the posterior surface. The one is tricep on the upper part of the posterior surface, and the second is enconius on the lower part of the posterior surface. The third muscle is brachialis, which is inserted on coronoid process and tuberosity of ulna. So the tuberosity is present on the anterior surface of the coronoid process. Look at the picture. This is the ulnar tuberosity which gives insertion to the brachialis muscle. So on the upper end, three muscles insert. Two muscles insert on the posterior surface of the Olecranon. So the two muscles which insert on the posterior surface of Olecranon are triceps and enconius. The third muscle inserts on the anterior surface of the coronoid, and on the anterior surface the most prominent is ulnar tuberosity. So the brachialis is inserted on the tuberosity of ulna. Look at the picture. This is the posterior surface which gives insertion to triceps and enconius. The third muscle inserts on the anterior surface of the coronoid process on the tuberosity of ulna, that is brachialis. So three muscles insert on the upper end. You have to remember that three muscles insert on the upper end. The one is triceps brachii, enconius and brachialis. Now these are the muscles which are written with red colored are the muscles which arises from the ulna. So the first is supinator. As the name indicates, arises from supinator crest, which is present just below the radial notch. Then there is the presence of Flexor Digitorum superficialis. This muscle arises from the medial margin of the coronoid process. Flexor Digitorum superficialis. This is the coronoid process, which is the forward projection of the upper end. On the lateral surface we have discussed radial notch. Below the radial notch there is the presence of supinator crest on which the supinator muscles arises. This one is the medial aspect or the medial margin of the coronoid process. So on the medial margin two muscles arise. The first is Flexor Digitorum superficialis and the second is Pronator teres. Then Flexor Digitorum profundus. The Flexor Digitorum profundus arises from anterior and medial surfaces. Simply you have to remember that the Flexor Digitorum profundus arises from anterior and medial surfaces of the shaft of ulna. But these both arises from upper 3/4 of the shaft of ulna, because from the lower part Pronator Quadratus arises. So Flexor Digitorum Profundus arises from anterior and medial surfaces of shaft of ulna, but from upper 3/4 of anterior and medial surfaces of shaft of ulna. The Pronator Quadratus arises from lower part of the anterior surface. So from the upper 3/4 Flexor Digitorum Profundus arises, whereas from the lower part Pronator Quadratus arises. Then Flexor Carpi Ulnaris, which arises from medial side of Olecranon process and from posterior border. This is Flexor Carpi Ulnaris, which arises from medial side of Olecranon process and from the posterior border. Then Extensor Carpi Ulnaris, which arises from the posterior border. So you have to remember that both the ulnaris, Flexor Carpi Ulnaris and Extensor Carpi Ulnaris, arises from the posterior border. Then there are three muscles which arises from the posterior surface. The one is abductor pollicis longus, extensor pollicis longus, and extensor indicis. These are the three muscles which arises from the posterior surface of the ulna as well as from the posterior surface of the radius. So you have to remember that these three muscles, that is abductor pollicis longus, look at the picture, abductor pollicis longus, extensor pollicis longus, and extensor indicis, arises from the posterior surface. Then intraosseous membrane we have discussed earlier, that is attached on the intraosseous border, extends from ulna to radius or from radius to ulna. Then there is oblique cord. Look at the picture, this is oblique cord which is attached on ulnar tuberosity. Then annular ligament which is attached on the radial notch of ulna, which covers the radial notch, or we can say which covers the superior radio-ulnar joint. This is the annular ligament which is attached or which covers the radial notch of the ulna. The radial notch takes part in the formation of superior radio-ulnar joint. Then the ulnar collateral ligament which is attached on the styloid process. This is ulnar collateral ligament which is attached to the styloid process. Now come to the clinicals. In the clinicals we will discuss the fractures of radius and ulna together, because the radius and ulna are attached to the humerus proximally and the carpal bones distally by a complex series of ligaments. So although the bones are separate, but they behave as a one bone. When there is a severe injury occurs to the forearm, it usually involves both bones, resulting in either the fracture of both bones or more commonly a fracture of one bone and a dislocation of the other. So we will discuss the fractures of these two bones together. And there are three types of fractures. The one is Montague's fracture. Now in this fracture, there is basically the fracture of proximal third of ulna. This one. There is the fracture of proximal third of ulna and anterior dislocation of head of radius at the elbow joint. So this fracture in which there is fracture of proximal third of ulna with anterior dislocation of head of radius is Montague's fracture. The second is Galeazzi's fracture. Now in this fracture there is basically fracture of distal third of radius associated with subluxation. Subluxation means partial dislocation of head of ulna at wrist joint. Look at this picture. This type of fracture usually occurs at the wrist joint, in which there is the fracture of the radius but there is dislocation of the head of ulna. The third is Cooley's fracture, which is the fracture and posterior displacement of the distal end of radius. In this fracture, only the radius bone is involved, in which there is fracture and posterior displacement of the distal end of radius.